Welcome to a new era of dentistry, the ultimate podcast for uncovering the latest trends, breakthroughs, and real life stories in the dental industry, hosted by Ashley Bond with Wisdom, along with co host Stephanie Neville. This podcast will explore hot topics, chat with industry leaders, and share the stories that are redefining how dental professionals enhance patient care and the dental practice environment. Let's get started and reshape the future of dental care together, one episode at a time. We have a really awesome and special guest today with us. We are here with Dr. Aditi Agarwal, dentist and co-founder and chief growth officer of Practice by Numbers. She is going to share some insights, including her personal journey, and we're just going to talk about a lot of things dental and growth and see where we go today. So that being said, Dr. Agarwal, what would you like to share first?
Hi, Stephanie. Thank you for having me. It's always a pleasure. How do you start with a journey in dentistry that has been so long and so rich that I'm truly blessed to at least be a small part of, my dental journey. Dentistry for me started at a very young age. I am an internationally trained dentist. And so I started technically dental school when I was 18. And I know it's 30 years of being a dentist and around teeth. What can I say? It really has become my life. I have, I think, held every role that there is in a dental office. I have been a dental associate for many years. I have done group practice. I have worked in, or now called a DSO. Back in the day, it was just a group practice. I have a solo practice being in private practice, and I have bought practice. I have done startups. I've kind of done it all. And now I am a co-founder of a dental software company, which never in my dreams I thought I would ever be a part of. So it really has been an amazing journey.
Wow, that is so incredible. I just thought of so many questions I want to ask you, but I want to start with the international dentist piece of it because, being active in Facebook groups and a lot of things that I see, I've seen always international dentists asking how to break into dentistry in the United States, but I've really feel like I've seen an uptick lately pertaining to that. Do you have any advice for those doctors looking to get started?
When I started my dental journey in the United States, this is over 22 years ago. So honestly, a lot has changed since. It was hard then. It's probably much harder now. The competition only, grows and expands, as you know. I would say get your grades in order. You have to beat the norm. So think outside the box, right? If possible, get involved with research while you're in dental school in India, if possible, or whichever part of the world you are in. You have to understand that you need to stand out from all the other applicants, and there are many now. And how would you stand out? Do more than just dentistry, whether it is community outreach, whether it is research, whether it is even just in clinical dentistry. Be the best you can so that you can stand out. And only when you stand out, you can fit in.
That is great advice. My next question, if you don't mind my asking, so, you've been all the things. Can you tell us what was your least favorite part and what was your favorite part? And then I kind of want to use that as a segue to talk about the technical side of things and what led you there.
So, least favorite part of which part of the journey, Stephanie?
Yeah, like any part, I mean, you've been through buying and selling and being an associate and being an owner. Like, I know there are a lot of dentists that can't stand administrative things. There are a lot that find they don't like being a clinician after all of that time and money. So I'm wondering what your experience was and what led you to pivot in the direction of practice by numbers.
Well, I honestly love being a dentist. I love chairside. That's
Mm.
where my passion and my heart is. I think it'll always be there. And what I struggled with is the administrative part. And especially in my startup practice, when I started up, it was in a depressed market. I did not know how to get torsos in the chair. Once I have them there, how to keep them there. It was always challenging, you know, understanding case acceptance. As dentists, we put a lot of pressure on ourselves. And I would always be like, why is this patient not accepting my treatment, right? Is it me? And 99%, I would always put the onus on myself, right? I'm like, what am I
Mm-hmm.
doing wrong? What am I not saying? Is it my communication style? And it wasn't until, I spent many, many hours, days, weeks fretting, not sleeping about, something simple as treatment acceptance. And I know I'm not the only one. And the thing is, how do you know if you don't measure anything? How do you know where is the problem? Right. And as a dentist, right, we need our tools to make a diagnosis. We need x rays, we need a perio chart, we need, obviously the visual exam. So we need all these components to make a proper diagnosis. And how is it that in our businesses, we just put things out in the universe, literally, and hope that things will happen without a proper diagnosis? And how can you treat a problem without a proper diagnosis? And my husband actually would be like, oh, you just need to understand your numbers. And I would be like, I don't understand what you're talking about. And I really tried very hard to understand my reports in EagleSoft. That's the software that I use. And I couldn't figure it out. And that's when my husband was like, okay, let me try to help you. And so he started with creating spreadsheets for me, which I'm a visual person. And I was like, this is awesome if I can understand them. And then I said, okay. Then he came up with a dashboard. That's when I really understood what the issue was. And I understood, oh, it is the fact that I did not have financial options that was causing the patients to walk out the door without scheduling treatment. And so, again, it was about diagnosing the problem. And that's when I realized the power of metrics and numbers. And that's where our journey started. That's what my husband and I both figured out, that there really wasn't at that time anything out there in the dental industry that would give us information that's within our own practice that we could use and utilize to help build our own practice. And so that's really how Practice by Numbers came about. It was a need, and it's always been a need that we have kept growing because there are problems and we keep trying to find solutions.
You really hit the nail on the head with metrics and, spreadsheets, also known as KPIs. And just to a little onus on my own part, going clinical to admin to front desk practice manager, I had a keen awareness of how important collections were because that's what keeps the doors open. And I had my paper as I was taught by my desk to make sure I was balancing and posting everything I could find. And somebody's working the aging report because we need those claims paid. But until I ventured into outsourced dental billing, where metrics have to be tracked very, very
Mhm.
precisely, obviously, I had no idea why it all mattered so much other than keeping the doors open, where the pain points were. And like you said, back then there was nothing out there to teach anybody that. I think dentists, office managers, everybody was just kind of winging it, like, we have enough money in the bank this month, so I guess we're okay. What can we do? So I love that part of your story. And I want to hear more about, how does Practice by Numbers help with that? And what is your favorite metric to track and why?
So, Practice by Numbers, now we track over 600 KPIs, which are completely customizable. What it allows you to do, honestly, is it allows you to plan. And I'm a planner. So planning for the future is important. It's important to know how many patients you're going to get ahead of time from hygiene, for instance, right? That 6 months from now, my hygiene is already booked out so much. So now I know approximately how much production I'm going to make from just hygiene, right? From recare appointments. 6 months from now. So now I know to reach my goal for that month, what do I need to do, right? In terms of doctor production, right? Do I need to work my butt off? Do I not need to work my butt off? Do I have enough personnel to support what I already have scheduled, right? Do I know my community is understanding the depth and breadth of their oral care, right? Because obviously, if you do a bunch of quad scales in 1 month, and 3, 4 months from now, they're not scheduled for their perio maintenance, they didn't understand the importance of their treatment. So it helps me understand so many little things about my patients and about my practice and about staffing and about insurances, right? That not tracking just the simple metric of your hygiene recare, right? Is to me, honestly, it's crazy. Because if it can give you so many insights and you can plan for a better future in your own practice. I mean, if you know you're going to get a certain amount of dollars from hygiene and whatever you produce on top is great, you can use that money to buy new toys.
Okay, what's your favorite toy? What's your favorite clinical toy?
You can get the scanner that you
Yes.
always wanted. I hate impressions.
Right. No kidding. I love that. Okay, so a software that 600 things. My mind was just thinking about money, but the patients are the
No,
most important thing. And
no, it's about the
it
health
sounds
of the
like,
patients.
yep. And that's what matters. I'm sure it also arms, dentists. I mentioned this in a podcast not too long ago, how often you're faced with, I hate the dentist and I don't want to be here. So, isn't it funny how the numbers that you just talked about and understanding the why helps you converse with patients who also feel that way? The numbers can bring in leverage for those emotional based conversations.
Yeah, I mean, it's changed the way I communicate with the patients, right? When I communicate in the truth powered by numbers, by metrics, there is no denying it. And so the acceptance that I get from patients is much better, much higher, because most people understand numbers. And most people do not want to be a number.
No, exactly. So true.
So if you use that power of numbers and explain to the patients that you don't want them to be a number and
Hmm.
that their health is important, and this is how, we can keep their health on top of them rather than them being a number, it makes a difference. Nobody wants to be a statistic, Stephanie.
So true. And that goes for staff as well. So, and you mentioned that, these numbers can help you see where your staff may need help. Or can you talk about that a little bit more?
Absolutely. Empowering our team is one of the lessons I learned very late in my career, right?
Mm-hmm.
I would try to do it all, be it all myself. And honestly, I'm one person and I was carrying this heavy load on my shoulders. And I felt like the number of boxes just kept getting heavier. And I started to develop this droop. And, I would remember my mom always used to tell me when I was young, stand up straight, posture is everything, right? And then you're already hunched up in a dental chair. And then you're carrying all this weight. And I think I
Mm-hmm.
felt like that droops just started to get like deeper. And I think I'm trying to remember when it actually was the pivotal moment. Unfortunately, I'm not able to remember right now, but there was a pivotal moment in my dental clinic when I realized that if I let go and allow my team to support me, Give them a task, motivate them. I no longer do performance reviews in terms of collection and production.
Wow. So do you just not need to because there's so much transparency with the metrics that are
I don't, every staff member in my office has a particular metric that is there that they own. And for them, they are bonused based on those metrics that they're supposed to track, own, and work on. And it may be for the hygienist as simple as the hygiene pre-appointment rate. You know, you can pick one, right? For your front office, it was for, it could be how many treatment coordinator, it could be number of patients scheduled based on the treatment that was presented, right? And how many people you would get scheduled even afterwards, right? So everybody has a particular metric what we work with. And what this does is it really empowers the team to bring the best out of them.
wow, that's so incredible. So, okay, offices that are thinking, I want to hear more about this. I want to learn more about this. Where should they go to get your help? What should they do? What does that look like?
So, practice by numbers does a lot at this point. We started our DNAs and metrics, and that's where we started. But we are full CRM. So now we do everything from forms, online booking, online view generation, post-op instructions, CAS insurance verification, email and text notification, everything that writes back into your PMX. That was very important for. And we also have phones and point of sale. So there's so many things that we can do to really tie everything together. And if you would love to find out about us, our website is the most comprehensive way, which is www.practicenumbers.com. So that's www.practicenumbers.com. And you can reach me at aditi.agarwal@practicenumbers.com, or also on social media. I'm very easy to find. They're not that many of me out there. And, just DM me on Facebook or LinkedIn, and I'm happy to answer any questions. I'm still a practicing dentist, and I still own 2 practices. So please give me some grace if I take a little time to respond to the messages, because if I don't, I'm in somebody's mouth.
Makes sense. Doctors are typically at the chair. I know we always try to give as much grace as we can with that. And we'll make sure that we include any published written content, that your contact information's in there. And you can reach Wisdom at info@withwisdom.com. If you missed anything or want to know more, we can always connect you to Dr. Agarwal as well. And that being said, practice by numbers, wisdom, insurance billing, patient billing, plus metrics, like you have the whole shebang between her and us. So why would you not want to reach out and give all that time and energy back to your staff to focus on your patients and have that concierge front desk experience instead of being frustrated by numbers and being on the phone with insurance companies and all of those things that your staff probably hates doing, but they just don't want to tell you, I hate doing this.
Absolutely. Absolutely. Use the power of platforms like
Mhm.
Wisdom, power of platforms like Practice by Numbers, because we were created to solve a problem, a
Yep.
very real problem in our dental world. And, lean on us because we
Mhm.
are here to help. Really, that's our mission, to be able to now, as a dentist, I can let go of so many of these issues so that when I'm with my patient, I'm really present with my patient.
Yes, I love that. And we're both here, and why wisdom is here. It's the passion for dentistry and the passion for the patient to let human beings do what they're best at, which is handle human beings and be kind and responsive and compassionate clinicians and administrative teams. So this has been such a
Exactly. Don't let your patient become a statistic.
Exactly. Yes, metrics and statistics are good, but not for making people feel like they are that. And that's at the end of the day why we're here. And you don't have to be a wisdom client or a practice by numbers client. What we're both saying is if you need help or have any questions, don't hesitate to reach out to either one of us. If we don't know the answer to something, we will direct you to a person who most likely does. We're here to help above all else. And Dr. Agarwal, thank you so much for sharing your insights and your journey with us today. I thank you and look forward to talking to you more.
Same here. Thank you so much, Stephanie. It was a pleasure.
Thank you. Thank you for joining us on today's journey through a new era of dentistry with your host, Ashley Bond. With wisdom in their network of industry leaders, each episode offers fresh insights and support in the evolving world of dentistry. Subscribe, stay tuned, and transform your career, practice, and patient experience. Until next time, keep innovating, keep caring, and stay smiling.